So just going to go through a few reminders. So just remember, yoga is all about breathing and moving. The goal is not to be the most flexible or have the perfect posture, perfect alignment. Just about feeling where your body is today, being aware, connecting the body and the mind, and seeing what you can do to move and make your body feel better. Okay, so that being said, again, listen to your body. I cannot feel what you're feeling, so I will guide you through some poses, but make sure that you're listening to your body and keeping it in that gentle stretch range. If you overstretch, you can cause injury. So just make sure everything feels comfortable. If you aren't sure about something or something doesn't feel right, just come to a comfortable position, focus on your breath, and then ask me any questions again at the end. And I don't think we have anyone live watching us that's pregnant, but if you're watching this later, make sure you use your wedge or a couple pillows to keep yourself off, just lying flat on your back for those poses. And if you have a prolapse, just make sure you're not pushing too much of your breath straight down. You're focusing more on those ribs. So again, we'll talk about the breathing, making sure with each inhale, you're trying to expand those ribs and breathe into your back, feeling the pelvic floor gently relax. And on the exhale, returning to normal. Okay, so we'll go ahead and start. We're going to be inhaling through our nose and exhaling through our mouth. So you can start in whatever position is comfortable for you. If you want a pillow, you can use it like last time. And so we're going to come lying down. You can keep your feet up if you prefer them up, or it can be spread out. So I'm going to keep my feet bent on the floor, and we're just going to start with some inhaling. So inhaling through the nose, expanding that rib cage, exhaling through the mouth, returning to normal. And as you breathe, we're going to bring some awareness, thinking about where our body is today. How do your feet feel on the floor? Is one pressing down more than the other? How do your hips feel? Are you holding any discomfort? Is your back against the floor? Is it arched? Just bringing the awareness there of where we are when we're starting. Any tension in the shoulders? Any pressure in the jaw, the forehead, the face? Is your breath going up into your chest or down into your ribs? Are you feeling any emotions or feelings that you might be holding on to today? Just acknowledging them, acknowledging where you are right now, and then bringing your focus to the breath. Trying to inhale, expand those ribs, feel your back relax. Exhale through the mouth, return to normal. Now on the next inhale, I want you to focus on breathing into the right pelvis. And taking 2 or 3 breaths here, seeing if you can feel your ribs move on the right, if that back is moving, if the pelvic floor is expanding down on your inhales. Then switching the focus over to the left side. A couple breaths here. Noting any differences between the right and the left. Just seeing where your body is now. And then focusing on breathing in the front of the pelvic floor. If your pelvic floor is that diamond shape, bring some breaths to the front part near the urethra. Does your breath move easily there? Then focusing more on the back, more near the tailbone. A couple breaths sending there. Are you able to expand down in that back part? Do you feel any movement or tightness? And then a couple more normal breaths, just breathing in through your nose and out through the back, out through the mouth. Now, if it feels comfortable, you're going to let your knees drop out to the side, coming in to butterfly. So feet stay close together, knees drop down to the floor. Taking 5 breaths here, if this is a comfortable position for you. Otherwise, just stay with your knees up. After that 5th breath, bringing the knees back up towards the ceiling. We're going to go into our pelvic tilts. So inhaling, letting that back arch up, and exhaling, flattening that back. Good. Inhaling, good, arching up, exhaling, relaxing back. A couple more breaths here. Now we'll try some clocks. So imagining like you have a pen coming out of your sacrum. You're going to breathe in and come around one side of the pelvis and breathe out, coming back to the back flat around the other side. So breathing in and breathing out. Following your breath. If you feel any areas of discomfort, avoiding that area, you can just go back and forth around that spot of discomfort, avoiding it. Otherwise, we're going to switch directions. Still inhaling, arching, exhaling, flattening that back around the circle. Inhaling, other side of the circle, exhaling, completing that. Now coming to the center when your sides feel even and finding that comfortable spot for your back. Not all the way arched, not all the way flat, but finding that comfortable position for you. Now we're going to inhale, and on the exhale, we're going to lift our butts up and come into a bridge. Inhaling down, exhaling, coming up. Now in this one, stay down, and let's check in. We want to make sure the front of our legs, our hips, stay nice and relaxed in the front, the hip flexors here. Okay, so making sure that we feel it through our glutes as we push up. So going as high as you can, finding that comfortable position where most of the work is happening in the back of your glutes. And holding that position while you keep breathing. And on the next inhale, coming back down. So checking in again, relaxing the front. Inhale, and on the exhale, coming up to a comfortable position. If you're having a hard time relaxing the front of your legs, you can dig in with your heels and activate those hamstrings a little bit more. We'd rather have them active than the front of the hips. And taking some nice breaths in this position. And inhale, relax. And now we're going to inhale the right leg up and cross it over. Now if this is comfortable for you here, you can stay in figure 4. We can bring that left leg up, holding behind the knee, bringing it up towards your chest. And focusing on your breath here, inhaling, lengthening, exhaling. So staying in this position here if that's comfortable, or grabbing right behind here. Making sure that you're not getting that pinching in that groin. Any pinching in that front, and you need to stay relaxed in this position here. Now from here, we're going to take our right hand, grabbing our right foot on the outside, coming into half happy baby. So you're coming from the outside, holding here. If this is comfortable, you can stay here. If you want a bit more, straighten that left leg down, breathing and relaxing. You can also hold behind the knee here if that's more comfortable. Feeling that stretch more in the back. No pinching in the front. Now we're going to let that right leg cross over our body and twist. You can put your left hand on that right knee to relax it down. Right arm stretches out to the side, opposite your leg. If you need more of a stretch, head follows your right hand. If this is uncomfortable, bend both knees up so you're more relaxed, and bring your head towards the left. Finding that comfortable stretch for you. Inhaling, expanding those ribs, relaxing the pelvic floor. On the next inhale, we'll come back up, pulling the back of the right leg, coming into our hamstring stretch. And so here, if it's comfortable, we're going to pump our toes up and down, feeling a nice, comfortable stretch through the back of the leg. And then holding it wherever it's comfortable and focusing back on the breath. Now you might hug your right leg in if that feels good, and then release it to the ground. Inhaling that left leg up, crossing it over. Staying here if that's comfortable, or pulling that right leg closer. Making sure to relax, not create any pinching in that hip. Focusing on that breath. Nice breath in. Exhaling, returning to normal. And the left hand's going to come and grab the outside of the left foot, coming into half happy baby. Extending that right leg long if that feels comfortable. Switching your grip to just behind the knees if that's more comfortable. Breathing in, expanding those ribs, feeling the lower back expand and the pelvic floor lengthen. Breathing out, returning to normal. Finding a position you can relax in. On the next exhale, crossing the leg over to the right, using that right arm if it feels good to press that left leg down. The left arm extends out. Head follows the left arm if that's comfortable. Finding the twist that feels right for you. Bend both knees up if that's more comfortable. And focusing on your breath here. Your mind starts to wander, any thoughts come in, just refocusing, feeling what your breath feels like coming in through your nose and out either through your mouth or nose, whatever position feels better to you now. And on the next exhale, coming up, grabbing the back of the left leg and coming into the hamstring stretch. If that's uncomfortable, you can bring your right leg up. And then pumping your toe, pointing and flexing, feeling that stretch go down the calf and hamstring. Staying in a comfortable range. And feeling where that stretch feels best and relaxing your foot there. And focusing back on your breath. You can hug that leg in if it feels good. Release it down. Now we're going to come into a sitting position, so you can either roll to your side and sit up, or you can rock your legs and rock up into a seated position. Now we're going to keep your right leg in front, and the left leg is going to go behind you. Coming to a position that you can relax in, trying to relax that left hip down, sitting up straight as you can comfortably. If you need more of a stretch, you can lean forward into it, or you can lean back a little bit, finding what feels best for you. And then coming up slowly and switching legs, bringing the left back out, sending the right behind you. Taking a few breaths here, and then coming into that comfortable stretch that you found on the other side, either forward or backwards. Just noting any differences in your sides, feeling which hip feels tighter today. And focusing on your breath. Making sure everything feels comfortable underneath. And then coming back into your seated position. We're going to come onto our hands and knees now. going to do some cat-cow. So breathing in, letting your back sag down, lifting up gently. Making sure you keep that neck comfortable. Exhaling, arching. And we'll try and put our knees about shoulder width distance apart. Your hands are right under your shoulders if that's comfortable. Adjusting as you need. Flowing with your breath, in and out. You can stay in one position for a couple breaths if you like. Wiggle your hips back and forth if that feels good. Inhaling, looking up, letting that back sag down. Exhaling, arching, head drops, spine comes up. And a couple more nice deep breaths, flowing in a comfortable range, not pushing your back too far. And then coming back to the center. You might widen your knees. We're going to come back into child's pose. You're going to sit back on your feet if that's comfortable for you. Letting your head drop down, arms come out. Use a pillow in the front if you like. Finding a position you can relax into. Your head can come to one side or the other. That feels more comfortable for you. Making sure you listen to your body and where it is today. A couple breaths here. Focusing on breathing into that lower back. Expanding with the inhale. Returning with the exhale. And on the next inhale, we're going to come back up. We're going to slowly come into standing. So I want you to feel your feet on the ground. Have a look down. Try and point your toes directly forward. Feet are directly under your hips. Going to spread your toes a little bit comfortably. Noticing the arches on both feet. Are they collapsing in? Are they really high out? Trying to come to a neutral position. A soft, comfortable bend in the knee. And then feeling our sit bones again. So we're just going to feel those bones in our glutes that we're supposed to sit on. And we're going to come into our mini squats if that's comfortable for you. Inhaling down. You should feel those bones spread apart. Exhaling, coming back up. Now making sure you're really sitting back, using those glute muscles and not your quads. Just a tiny bend, and back up. Inhaling, coming down, sitting back. And if it's comfortable here, you're going to hold it here for a couple breaths. Making sure you're feeling that in your glutes, as if you're sitting back into a chair. And if you can feel your sit bones spreading and you're comfortable, you can reach out with your hands a little bit into seated chair pose. Exhaling, coming back up. So you can either come back down, inhale, just a mini squat, feeling those sit bones come apart. You can stay here or you can do some flowing, making sure it feels all right on your knees, your hips, your back, feeling where your body feels today. Then coming back up, stepping your feet apart, leaning. We're going to do side lunge. You can come back and forth. That feels good. And then find yourself coming to the right side and holding it here for a couple breaths. Feeling a nice stretch in the left inner thigh. Making sure that's comfortable on the right knee. And then when you're ready, coming to the left. Just a nice, gentle, comfortable stretch. When your sides feel even, come back to the center. We're going to inhale our arms up. Exhale through heart center. Inhale up. Exhale through heart center. We'll do two more. On the inhales, making sure you get that nice breath. Seeing if you can feel your pelvic floor relax in this position. And last one. Then we're going to slowly come back to a seated position. And then lying down. You can either do regular happy baby, or you can bring both knees up towards your chest, letting those legs relax down. Relax the sides, trying to let go of any tension. Finding that comfortable position for you. If you feel like you need to, you can rock side to side. That feels comfortable on your back. Or just holding and relaxing. Trying to let go of any last tension. Anything you might be holding in your face or your jaw, your forehead, relaxing. And if it feels good, you might curl up into a little ball, bringing your head to your knees. One last breath, and then finding your position of relaxing. So either keeping your knees bent up if that feels better on your back, or letting them come long to your final resting position. You might feel better taking up a bit of space, letting your legs come out and your arms come out to the side a little bit. But finding a position you can hold and relax. So you're just going to relax your legs, focusing on your breath, feeling any differences you might feel now, noting anything that might have changed over the course of the session. Feel any more tension resting in one spot of your body, breathing into that area, and letting it go. If your mind starts to wander, just bringing it back, focusing on that breath in and out. And slowly start to wiggle your fingers and your toes. You can keep your eyes closed as you roll to one side and sit up, push up into sitting. And when you're ready, take a couple breaths here. Just making sure you tell yourself thank you for taking this time to restore your mind and move your body. Days can get busy, and it's really important to dedicate some time to ourselves. Blinking your eyes open when you're ready. Take a bow forward if you like. Namaste.